Persons accessing health care at People's Hospital and clinics will soon be asked to pay a bit more than they are accustomed to. According to Chairman of the BVI Health Services Authority, John Klein, the increase is expected to help to improve their health care services. Walter Barrett has this report.
The BVI Health Services Authority visited residents in East End and Long Look this week to talk about the crucial topic of health care in the BVI. Addressing the crowd was Chairman of the Health Services Authority, John Klein, who said that in order to improve the quality of health care offered in the BVI presently, the fees necessary to access that health care must be increased.
If we're going to give you better care, we're going to have to increase what is paid. And the money has to come from somewhere. The government as it stands is under financial constraint. Last year we asked the government to give us $30 million, and that is not any fluff money. It's money that's required to run the system. We got 26 million. That is what we were given, and so we have to cut and squeeze and do all of this. If we don't have the necessary money to improve care, we can't get quality doctors, we can't get specialists. There's so many things we can't get. So eventually you pay, but you pay the money in Puerto Rico, you pay the money in St. Thomas, you pay the money in Miami. So eventually money comes out of your pocket. We're not trying to make it unaffordable. And the National Health Insurance, as it comes on stream, will address some of those people who can't afford by themselves to have insurance.
The chairman said one of the problems the Health Services Authority and government currently face is providing health care for persons who have no insurance, particularly if they need care overseas. He said providing health care for such persons is becoming an unsustainable task for government.
We have been facing challenges when we meet people without insurance that we cannot deny health care to, especially if we have to fly them off island for care. An air ambulance to Puerto Rico, Jamaica, Panama, US is minimum $17,000. If you go to the US, they want $200,000 up front. If you go to Puerto Rico, it's about between $50,000 to $100,000. If you go to Jamaica, it's $20,000. They want that money up front for people who do not have insurance. Where does that money come from? If the family can't afford it, the person doesn't have insurance, it has to come from somewhere. Either it comes from the health services or it comes from government. Ladies and gentlemen, that is not sustainable.
Meanwhile, newly appointed Chief Executive Officer of the BVI Health Services Authority, Darlene Cathy Batiste, revealed that approximately $28 million is owed to the BVI HSA since its inception. She said the Health Services Authority is asking persons who have outstanding bills to commit to paying off those bills. The BVI HSA chairman said one of the ways the board has come up with to get the community involved in supporting the hospital and other healthcare facilities across the territory is the setting up of the Friends of the BVI Health Services Authority program, where persons can make financial donations toward improving these facilities and the services they provide to the community. He added that the authority will also receive some form of relief once the National Health Insurance Scheme gets underway, which also ensures that residents have some sort of financial coverage should the needs arise. This is Walter Barrett reporting for JTV News.